Well, we're going to go ahead and dive right in. Hi, I'm Michelle Wilder Rivers, and I'll be moderating today's talk. We're going to talk about arts and health, non-traditional and interdisciplinary careers. We'll be starting, and I ask that you kind of use the question and answer option in the on the side there if you have questions along the way. And we're going to dive right in. You can see our panel bios in the chat too if you're curious along the way. But I'm going to ask them to kind of leap into today's conversation if you guys will come back on screen. And we're going to start with our faculty guests, Anna Carapalati, Heather Spooner. We have Interim Assistant Director Brandon Talg, and our MA candidate and current student, Kate Beck. Thank you, guys. So we're going to start right off hot with when people ask, so what do you actually do? How do you answer? Heather, do you want to answer first?
Sure. If I had to give like one general answer, it would probably be something along the lines of using the arts to improve health, well-being, and quality of life. But in reality, I feel like the work I do spans so many different types of work, whether that's the teaching, the work I'm doing with research and therapy with veterans, or the community and disaster work, that more often I really do try to cater the response to the person that I'm speaking with and what our intention or our meeting is about for the day.
That makes a lot of sense. So, Anna, how about you?
Remind me of the question one more time, just so I get it right.
Yeah. So when people ask, what do you actually do? How do you answer?
Yeah, so I think I would answer that in two ways. I teach, so I'm a lecturer in the Center for Arts and Medicine. I also facilitate dance classes for people of all ages. And related to that, I'm interested in finding healthful approaches to teaching dance and dancing with others. A lot of my research has to do with evaluating dance programs and researching the lived experience of them. And my first career was as a professional ballet dancer. And so I'm also interested in how health can be more present in those kinds of dance spaces.
Thank you, Anna. How about you, Brandon? What do you actually do?
Yeah, the way that I explain it to people is that I do arts administration in any with any hat that I wear, whether that's my hat at the Center for Arts and Medicine, which primarily falls into the category of academic administration, or if it's the hat that I wear as a community organizer and community leader in a lot of different art spaces. It really boils down to arts administration, which is an easy way to say a lot of paperwork and spreadsheets and keeping things in order.
Awesome. Thank you, Brandon. How about you, Kate? How do you respond when people ask, so what do you do?
I would say the fun way, kind of like everybody's doing in the chat, is to have connection be the key, whether that's connecting people to themselves, to each other, to their community. So that connector role. And I think that's what it all boils down to. And then we all put on all the dozens of hats that we're wearing. So sometimes that's administration work as I'm trying to get a new collaborative up off the ground. It can be consultant work that I'm doing through my own LLC into other spaces that are looking and seeking advice or somebody to come talk a little bit more about arts and health. So I think we're all doing this in a lot of different ways and even teaching dance to connect people to their body. So it really can shape shift. And like Heather said, you want to make sure that you're able to articulate that specific hat when you are with a certain audience as well.
So we're going to move on to our next question, which is thinking about nonlinear paths and maybe unexpected turns in your path. So when did you realize that your path didn't fit into one category? Did your role even exist when you started? And what should folks considering the field of arts and health keep in mind? So I'm going to start with Anna this time.
Yeah, so I think that started for me when I graduated high school. I decided to pursue a career as a dancer, which my father was concerned that I was not going to university to get a degree, but now I have a PhD, so he just needed to to be a little more patient, I think. Um, but yeah, so, I unfortunately, my dance career ended earlier than I hoped due to some injuries. And I always sort of had this idea in the back of my mind that I was going to go into healthcare. if I wasn't going to work in dance. So I was pre-med um, briefly at the University of Pennsylvania. And through one of my courses, I discovered this academic literature about music in the brain, which led me to learning about Dance for Parkinson's, this organization based out of New York City. And yeah, so that sort of gave me the idea that I didn't have to let the arts go, that I could put this sort of, my passion for working in the arts and this interest in healthcare together. So yeah, from there I went on to do my PhD studying dance and Parkinson's, and now I'm here working at the Center for Arts and Medicine. So I've always just sort of, yeah, pursued my interests and often by surprise discovered what it was I actually wanted to be doing.
Okay, as a current student, I'd like to hear your perspective on when did you realize that you didn't fit into one category in your path?
Yeah, I think kind of similar to Anna, I was also dancing professionally, but I came into that space through an education outreach program that really shaped my relationship with ballet as more of a way to make me feel awesome rather than hyper fixating on the technique. And so I was always attracted to what made other people feel awesome, what turned them on, what made them tick. And I think I always gravitated to that in side work. A lot of times as a dancer, you're still working other jobs just to be financially salient. So I always noticed that I was drawn towards these sorts of outreach programs, community engagement work, but it was really during COVID when the dance company was off that I started working remotely and connecting a lot of non-dancers to their bodies in really meaningful ways that became ultra exciting for me. And I realized that's not something that is a day-to-day kind of dancer job, but I'm not quite sure where this fits. It's not just fitness instructor, there's a social component. So I think during COVID, I fell into that, and then I learned more about the fields of arts and health and social prescribing. So I figured that would be a good place for me to head next. And so that's what I'm doing now.
Awesome. Thank you, Kate. How about you, Heather? Any twists and turns in your path?
I think there's always twists and turns in my path, even to this day. Part of what I try to do is just really stay open and look for opportunities and kind of look where excitement comes. It's funny because Anna was saying that when she first graduated high school, her dad wasn't happy she wasn't going to university. And I would say I was going to university. I knew I wanted to be an art therapist. My dad still wasn't happy because that didn't seem like it was secure enough of a career or field, right? And it's funny because I graduated with my master's and came down to Tampa, and I think most people think of art therapy as being sort of the more established and longer field versus arts and health, but that was the exact opposite of my experience here in Florida. We had this great program here with UF Health Arts and Medicine. I was over in Tampa where the Rothett Cancer Center was there for a long time, and there were really no art therapists here in the area. And so, whereas many art therapists kind of lean into their mental health degree and will kind of get jobs as counselors, I found that when I did that, I really lost what I loved about the art therapy and the arts piece, and more started exploring all of the different ways that people were using the arts in other contexts, whether that be like it used to be VSA Florida, but now it's Arts for All Florida. The VSA program's kind of reconfigured, but I did work with them with Arts for Disabilities. I did work with museums and outreach and education. And at the time, the few art therapists I met were really confused by what I was doing. And it's funny because 10 or 15 years later, I started having art therapists reach out to me and be like, oh, wow, this stuff is so exciting. And I get it now. I knew what you were doing back then. So it's really been a fun trajectory.
Awesome. Thank you for sharing. Brandon, what's an unexpected turn that's become essential in your path?
Yeah, I mean, I definitely second Heather's perspective that these things happen all the time, unexpected changes. But I think for me, the biggest one that really set my career in motion came from a disappointment, really. My bachelor's degree was in theater, specifically for stage management. Y'all, I had the dream to go hit the bricks and work on Broadway, and frankly, many of my classmates, the ones who moved to New York, ended up finding it was a whole lot easier to work on Broadway as a stage manager than it was as an actor if you were somewhat good. Or let's just say you do what you say you're going to do and you show up on time. So there was a potential path for me. My first job out of college was at Cirque du Soleil in Orlando. So I had this pathway ahead of me, and then um, had a kid at a younger age than maybe I was expecting. Life got in the way, and I was seeing that to work a night job, which theater is one, and to raise a kid were not compatible for the life that I wanted to live in this new situation that I found myself in as a father. So I moved back home, got a job at the University of Florida doing something not in the arts because I needed to pay the bills. And the unexpected thing came from, again, I'm like, what am I supposed to do? I have this theater degree. How do I still do what I want to do if I'm not going to be able to do theater? Right. So I'm working at UF and I start going back to school. And the first class that I take is called Interpersonal Leadership. And the instructor is very much Dead Poet Society style, unorthodox professor who's like, you can't lead others till you understand yourself. And he engages us in this semester long exploration of our personal stories and why we choose to do the things that we choose to do, because you can't lead others until you understand yourself. And that class, which I was taking, I didn't mention this, I was going to school just to get some other degree like on my resume other than theater so that I could get hired doing something. That class changed it all for me because this understanding of storytelling that it's so powerful moved me into a space of creating a nonprofit that helped people to write and share their stories, really directly tied to that class. So I have everything else, and there's more time to dig into the whys and what's and wheres, but like I'm here now because of that experience because it put me into this nonprofit space. It put me into this arts management space, this arts development space that I had no idea was even a possibility. So it was hard in the moment, but in the long term, it was really one of those life-changing moments before and after, I'm a different person.
That's awesome. Thanks for sharing, Brandon. All right, we're going to switch gears now. We're going to talk about working between systems. So we have arts and health, and they go together. Or do they go together? I guess I hope so. So we're going to ask, how do you balance this creative work within institutions? Heather, do you want to go first with that one?
Yeah, I can. And I mean, in some ways it's a balance, but in other ways, I'm not sure that it's necessarily a balance because institutions do value creativity. They talk about innovation. They're not always structured in ways that encourage innovation, but they do want it. And I think part of that's just the fear of risk and liability, which is very real. And oftentimes, somebody new to the setting doesn't know all of the factors that kind of go into those guidelines that are put into place. So I think it's really important just to get to learn the setting, learn what it values, the ways innovation is welcome, and also find out what the boundaries are, what things you have to stay in, and understand why those rules are in place so that you can find ways to be creative within that. And sometimes you don't always have to stay within it. It's one of those situations where when you learn where the boundaries are and what the rules are, sometimes that gives you ways to break them, right? So it's not that we always have to stay structured, but I think it is really important to get to know whoever you're working with, whether that's institutions or individuals, really well so that the work you do is aligned with them.
Well said. Anna, do you want to add anything to that?
Yeah, I think I agree with Heather that I don't necessarily feel like these things are in competition or, I think they actually go well together, hand in hand. I aspire to be the type of lecturer professor like the one that Brandon had who creates transformative experiences for people. And I think like integrating these sort of creative practices within courses is how that happens. Yeah, for me, I feel like in my role here, everything comes together in a way that allows like all these different aspects of my professional life to really thrive.
Awesome. So when we're thinking about this kind of stuff too, how do we translate art into metrics and outcome languages? What empowers us in that way? Heather, do you want to hit that one?
Sure. I think there's growing ways for us to do that are established, right? There's lots more focus now on mixed methods research, qualitative research, arts-based research. And so it's really encouraging to see the number of ways that are out there. And anyone who's interested in that can certainly just kind of go up and look up articles. That's one of the things we do a lot in our program is kind of introduce people to the articles that are out there. And while we have the benefit of having a university library, tools like Google Scholar have made those much more accessible to almost everybody than they used to be. And then there's also a matter of partnership. I think it's really hard as artists to be able to do all the different facets of research that really help us translate those outcomes. And so most of the best research I've done where we've been able to do that the most successfully has been research where we're partnering with healthcare professionals, researchers, people in other fields. And while we certainly have easier ways to do that as a university and more access, even before I came here to work with UF, I often was able to build those kinds of partnerships through presentations, networking in the community, where you are able to get that expertise. And I think that's something that Kate's talked a lot about in the work that she's doing right now, is how important it is to have those interdisciplinary collaborations and kind of round out all of our skill sets. And research and translating outcomes is one of those areas where that seems particularly important to me.
Awesome. What do you think, Anna? Do you have any thoughts on that one too?
Yeah, I definitely think that measuring the impact of the arts has come a long way. I mean, even since I entered the field, which was only about 10 years ago, but I think at first it was often trying to fit a square peg into a round hole, and that we were trying to apply health like methods that were like tried and tested in the healthcare setting, which the arts don't necessarily fit into so easily. And so I think now there's a lot more open-mindedness in how we can establish the benefit, like measure and demonstrate the benefits of the arts. And I also think the arts presents a really unique opportunity to make people really the protagonists of research. So in a lot of like outcomes-based research, it's like the treatment or the drug is the protagonist, and in arts and health, it really is an opportunity to let people share their stories. And so that's something else I really love about the work.
Thank you. Well, now something that comes up in this field is talks around the ethics and maybe some tensions around that sometimes, or burnout and sustainability. We're just going to kind of think about those topics as we go into this next round. So maybe Anna, I'll stick with you for a minute and ask what tensions or ethical challenges kind of show up in this work sometimes, or how would you approach that?
Well, I guess related to your last question, sort of this pressure to measure. So that's sort of how, like, a lot of, funders or institutions or organizations, they want to see outcomes when there's a lot of intrinsic value in the arts that is really hard to quantify and very intangible and hard to sometimes even put words to. So I think this sort of pressure sometimes to deliver an outcome when sometimes you've really arrived at more questions than answers. So that's something that I think comes up for me a lot in my work.
And Heather, I would ask with that too. I'll give you a chance on this one. When we talk about ethics and burnout and sustainability and how you look at your creativity in the work, what would you want to share on those things?
I think regarding ethics, there's an ethical responsibility we all have to advocate for the work and for the benefits of it. And that's even part of like NOAA's ethical guidelines. But I think there's also an ethical responsibility to admit what we don't know or the areas where the evidence is evolving. And I there's lots of times when we want to reassure people and the public for the benefits of the art. Perhaps when you're standing up in front of someone to start a Dance for Parkinson's program, right? You'll have to talk about those benefits to help people feel reassured and make them be willing to do it. But there's also other audiences like academics or healthcare professionals or some of the more scientific audiences where overstating the evidence can actually harm us in the field. And that's something that a lot of people don't think about seriously enough. So I would encourage people to say, yeah, there is some evidence, but perhaps to qualify that a little bit with those areas we don't know. And one specific example that's come up a lot recently in my work is a lot of both art therapists and arts and health professionals talk about how we have an evidence-based practice. And there is evidence, but evidence-based practice actually means something very specific to research-minded audiences. It's about doing something that has a huge body of evidence and where you're doing it in such a way that aligns with that evidence. And so we've actually moved a bit in some of my work to talking about evidence-informed practices. What we're doing is informed by the evidence, but not necessarily entirely based in it. And so I want people to think about both of those ethical responsibilities, how we advocate, but also how we're honest about the things that are still more nascent.
Thank you. And I would ask as a follow-up, you and I had a lovely conversation about burnout and sustainability, and I loved your view on that. Could you talk a little bit about sustainability in the field of arts and health careers?
Sure. I don't even know if I know what that conversation was, but I'll answer a little bit. And if there was something I missed, let me know. I think having worked in the field for a long time, it definitely goes in peaks and valleys. There's times where I'm very, very energized and times where I'm very stressed out with everything happening. But even, I mean, we're talking about kind of creativity a lot in this session. And I think even the times where I've been too busy to actively create art, there's never been a time when I haven't been able to draw from my creativity some way to sustain the work that I'm doing. And sometimes that's just something like really simple, like pausing and noticing beauty and creativity around me. I know there were a lot of political changes last year, and I work with some federal systems. So there was a whole lot of stress going on about a year ago. And sometimes just pausing for a minute to notice a flower was like the only thing I could do to kind of revive myself for a few minutes in my day. And then also finding ways that channeling creativity into things that might not always seem creative, right? We can be creative with presentations and talks, and numbers and metrics, oddly enough, can be a very creative process. And so finding ways to really channel the strengths we have as creatives has been really helpful for me in sustaining the times when I can't actively engage in art as much as I'd like.
Thank you, Heather. Anna, would you like to touch on that?
Sure. Yeah. So I think one of the things I like most about this work is how rewarding it is. And I think that makes the practice for me really sustainable. And, you know, one of the reasons that I transitioned into this field is because I was like very burned out as a dancer. And I felt like I was reaching a point in my very early in a point in my career realizing that it wasn't a sustainable one. And so what I really have loved about arts and health is that it's like created a space where like I can continue to use my body and be creative in a new way that's really rewarding.
Thank you. All right, we're going to talk a little bit about breaking into the field. And Kate, I'm going to ask you to talk a little bit about what do you think that people need to succeed when you're breaking into the field?
As you said, I'm doing that right now, so I'm in the midst of it. But I think, and this kind of comes back to with dance, you know, you can transfer a lot of skills from one thing to the next. So I don't think it means when you break in that you come empty-handed. I know a lot of artists are incredibly resourceful, resilient, you know, creative problem solvers. So I think whatever field you're breaking in from, you bring that backpack of expertise with you. That said, I think you have to also be ready to learn a lot of skills to help you articulate what you're trying to do. And I think coming to this field, I had this lifelong experience of embodied knowledge starting in a arts outreach program that totally, you know, changed my perspective. And I think I saw some people from Richmond, Virginia. So shout out to Minds in Motion. But anyway, so I think that gave me the internal fire. But then it is tricky to advocate for a field that a lot of people don't know about. And I know Heather was saying, you know, the creative arts therapies have their own barriers, but I especially feel like I'm constantly telling people what arts and health is and what social prescribing is. So I think learning the language to be able to articulate that almost like childlike, emotional response has been something that I really needed to work on in this program, because I felt like a kid that couldn't really explain what they wanted and needed, but it was there, it was very there. So I think as far as coming to this field, you have to have your passion to make it sustainable. It is rewarding, but you also have to have your thinking cap on as far as how you're going to be able to um, frame it, advocate for it, and build something that maybe doesn't exist yet. A lot of times it's not posted on LinkedIn. If you want to be a link worker, but there's no infrastructure, then you're going to have to come to the table with more than just a want for a role, maybe more of a systems oriented approach. So being open-minded to maybe doing some building as well.
Awesome. And then Heather, maybe I'd ask you to follow up with when we're looking at the field and what is going to kind of be in that backpack that Kate mentioned, and we think about things like initiative and relationships and credentials, how do those things kind of fit together to help us succeed?
Yeah, I think regardless of what credentials you have or how much initiative that you may bring, and those are important things that can be really helpful in opening doors. If you don't have the ability to build relationships, they won't translate in the ways that you want to. It's really important to be able to know who you're speaking with, learn what their needs are, and be able to connect with them. And then from there, you can really use those credentials again, might get you in the door. It's something that you may need to do the work. Your initiative will be what helps you to move that forward and get the actual project done. But that door might never be opened for you if you don't have the ability to connect and build those relationships.
Anna, do you have anything to
can I
add?
speak to
Oh,
that?
yeah. Yeah.
I mean, relatedly, I think that it can be easy to say, how do I get like, it's easy to get like wrapped up in this idea of how do I break into this field, right? Whether it's arts and health or anything else. But the reality is that most fields, almost all fields that people would be interested in going into are very similar in how you quote unquote, break into them. It's what you do. It's, yes, it is at some level who you know, and it's what you're known for. But the who you know thing is something that you can build. There's a book that has been really influential for me. I've taught classes on the concepts that it presents. It's called The Defining Decade by Meg Jay. I was actually just looking for my copy on my shelf, but I realized I gave it away as I usually do. So I just bought another copy 5 minutes ago. The concept is identity capital, and it's this idea that all the things that you do um, build towards what people understand who you are to be in the world, your identity. That can be a degree, volunteering, literally meeting people, work. It's this collection of personal assets, skills, and experiences and credentials that you accumulate over time. Which again, you build these things by going, by doing, by building relationships and meeting people. It shows that you know what you're doing, and your identity, which is again the accumulation of all these things in other people's eyes, um, is what you become known for in the community. Whether you're talking about your city or the field that you want to be in, or your job, or your institution, whatever. So when an opportunity arises, often those in control of those opportunities look for the people that they know that can do a certain thing, and they're only going to know if you can do that thing if you've taken the time to build that identity through all these other things that you do. So again, this is arts and health is no different than any other field in some ways in this way.
Thank you, Brandon. Anna, do you want to talk on the power of initiative, relationships, and credentials in arts and health too?
Yeah, so I think, yeah, just to echo and build upon what the other panelists have said, I agree. Relationships are really important. Particularly with arts and health being a newer field, that also means that often in newer fields resources are limited. So figuring out how to approach people so that you can like work together and lift up the work without anyone feeling like you're maybe drawing away from maybe something that they're building in the community. I think in terms of initiative, just an openness to learn. Arts and health is an interdisciplinary field. And so there's so much that you can learn and understand that can support your practice. Certainly when I started leading dance classes for people living with Parkinson's 10 years ago, there was so much I didn't know about social sciences or, things that I could have brought, that I now bring into my practice, that I wasn't aware of then. So just this sort of open-mindedness and curiosity to learn. And then what was the third one? Yeah, credentials. Yeah, so I think that goes along with that. So, just as Brandon was saying, building up your identity in a way so that you can be a trusted person within this community.
Thank you, Anna. All right, so we're going to talk next about what's coming next in arts and health, challenges and opportunities. Heather, would you like to start off this one? Oh, I think we're still on mute.
Yep. Thank you. Yeah, I mean, I'm really excited to see all of the growth and attention that arts and health is getting in so many different fields right now in such a different way than I've ever seen before, whether that's the public health work, the social prescribing, arts and neuroscience, all of these things didn't even really exist, even when I first started here at the center. And I think there's lots of opportunities from that exponential growth. There's more awareness. I know, Kate, you were talking about having to explain to everybody you connect with what this work is, but I also find I'm having to do that less. People are at least showing some familiarity. They may have heard of the concept before much more often than I noticed before. And perhaps I need to fill in some gaps or explain things. But the concept is not as unusual as it used to be, which I think really helps prime people for the type of work that we're doing in a new way. I also am interested to see how all of this comes into play with the growth of technology and things like AI. It's funny because not that many years ago, everyone was like, oh, you have to become a computer programmer, and that's something to do that's really safe. And obviously now with AI, that doesn't feel so safe in the same way anymore. But more and more, I'm noticing people talk about interdisciplinarity, the ability to have relationship, creativity in the arts and innovation as being some of those things that maybe AI is not able to do so well. And I think people are starting to recognize the value in some of the skill sets that we all have as artists. We may not be used to explaining our work in that way, but it's absolutely the space that we can fill in those interdisciplinary aspects that I think there will be a growing need for. I guess that's it.
Thank you. I recently heard a professor talking about our next round of workers being the compassion that's in the AI, and I loved that, being the compassion. And is there something you'd like to add to the conversation about arts and health, what's coming next?
Yeah, I think Heather touched on, so much of it already. I do think with the rise in technology, arts and health, it's actually a big opportunity for it. People I think are craving connection and, in now we have to say in-person experiences with one another. And yeah, I think that artists in this day and age have a lot of skills that are going to be really valuable in making that happen. And yeah, I've also seen the development of it, arts and health, sort of like entering other academic disciplines that it didn't have such a prominent place in before. And I think all of that strengthens the field.
Thank you. Kate, do you want to add a little bit to this one too?
Sure. I think I've done a lot of work with youth specifically, and I think and thank you, Heather, for clarifying that it's different now from how it was in, previous decades or years, because I am newer into this field. So maybe it seems like a lot of people don't know, but it's more than it used to be, which is good. I have been teaching youth for almost 15 years now, and I have seen a big shift in their social kind of effervescence. It's, even the hallways used to be a lot more, alive and organic, and everybody you just kind of goes into their own bubble. And I think COVID obviously had a huge impact. The more we're, absorbed in ever quicker pace of technological development and AI, I think there's going to be a similar almost, and I see it with the kids, is there's almost a rebellion, kind of like the farm to table movement. So we had, fresh food for the majority of human existence, and then in the 60s and everything, it became very trendy to can and process and freeze, and now there's this kind of reawakening of connecting people's food to a natural source. And I see kids craving that because they don't maybe get it organically. So I think there's going to be a huge role to create almost human connection specialists. And I think that arts and health really can help people curate something that maybe would have come up more naturally in previous educational institutions. But this can, and I'm helping with programs in schools, bring kids into safe spaces to express and to be able to connect and almost to coach them through that. So I think, as incredibly powerful as AI is, and I think as a field we need to accept that there's also a superpower that comes from the ultra human component, and arts and health helps to distill that core power, I would say.
Awesome. Thank you, Kurt. And Kate, as we're looking forward to these other things, is there a story that you would want to share that reminds you why this work matters?
I think really there's so many. I said this, but I could talk all day about this. And I'm sure everyone on this call honestly has their own reason, because why the heck would you be in here? But just to kind of uplift other people, I was able to do the fall arts and health intensive at UF in partnership with Shands Hospital. And as part of that experience, I usually end up doing more community facing, broader population outreach sorts of arts and health, but I was able to follow around one of the arts and health practitioners, Ricky, who's a musician, in the hospital rooms, which is something I had a lot less experience with. So I think going into the experience, I was like, oh, I know how magical it's going to be. It'll be really nice. And I was crying. Like, it was just miraculous to see people's emotional and physical response when he would go into the room and they might be lying there in a lot of pain, and just to see their whole bodies exhale. And even sometimes the heart rate monitors would slow down a little bit. I mean, it really felt transformative. And so I wanted to uplift that experience was impactful for the participants that Ricky was playing to. He's very talented, but also I was able to witness something on the outside. It wasn't me doing it, but just to see the beauty that happened between the two of those people. And then he did it like 6 times with everybody we walked in the room with, which was very impressive. So I'd say that's one little moment.
Thank you, Kate. Anna, do you have a story about why this work matters that you'd like to share?
Sure, let me think. Which one do I want to share? Yeah, the one that's coming to my mind first, which was really, one of the reasons why I decided to pursue a PhD actually, was in one of the very early dance classes I was leading with a group of people living with Parkinson's. There was a man there who, I had never seen walk without his rollator. And at the end of one class, he requested a song, and we put this song on, and he leapt out of his chair and was like spinning me around. It was just the most incredible transformation I had ever witnessed. And so I thought, wow, this work is really important. And I wanted to learn more how to create more moments like that.
Thank you, Anna. But Brandon, do you want to share a story about why this work matters?
Yeah, absolutely. So, for those of us in different sides of the arts and health space, we experience and see different sides of what arts and health looks like and means to people. And for me, as an administrator and as someone who intakes students and helps act as sort of an academic advisor, even though that's not technically my role, if you want to get into the nitty-gritty of it. Um, not too long ago, about a year ago, I had a student be referred to me by someone in the occupational therapy department at the University of Florida. This was someone who was very close to graduating with their PhD as an occupational therapist. And she was like, I am done. I want to work in music. I do not want to work in, I don't want to be an occupational therapist anymore. And they were referred to me because we at the Center for Arts and Medicine have graduate opportunities for educating future artists and healthcare practitioners, and OT is one of those. And so I was able to sit down with this student who was really excited and fired up about working in music, wasn't sure what that meant exactly. But knowing that this student had already invested so many years and so much time in this occupational therapy field, I was able to advise her to finish it out because you'll have this credential and you can get jobs on like 1 day a week as an OT. Probably you'll make enough money that you'd be comparable to working as a barista, what many other music related people are doing for 40 hours a week. Secondly, you won't have wasted all that time. And third, if you're working a minimal number of hours as an OT, you can work on the rest of your time in the music space, right? Build up your credentials in that music space. But while you're a student here at the University of Florida, you can also get connected with the arts and medicine program here, the center, and also at the hospital. And that's what she did. She had a practicum that she needed to do, and she did it at UF Health Shands Arts and Medicine, which was a way to marry her interests and her passions. And while she was doing all of that and finishing up her studies, I also was able to connect her with some people in the music community here in Gainesville, where she started booking shows. She started getting to know artists. She started helping artists build their sort of repertoire outside of just Gainesville. And she graduated earlier this year, only a few months ago. She moved to Atlanta, and she just reported back to me the other day to say, hey, thank you so much for your advice earlier, because I've been working as an OT, paying my bills through that minimally. And through the work that I did in the music community in Gainesville, I was able to build up enough of a reputation for myself that I've gotten a job as a junior talent buyer at one of the more respectable venues in Atlanta, like a real good one. And she was able to quit working as an OT, which she didn't want to do anyway. She was just doing it to pay the bills. And all that to say, like, these small interactions that we can have in any space in our lives can be transformative for other people. And for me, it is really meaningful in this role to be able to be a small part in transforming the direction of someone else's life into the direction that they want to go. And arts and health was a part of that journey for her.
Thank you, Brandon. Heather, do you want to give us a story real quick too?
Sure. I think anytime I start entering into new spaces or doing new types of work, I'm kind of reminded again of how important this work is and in a different way. And most recently, that's really been happening with the arts and disaster work we've been doing. And in part, it's because the people we're working with are not people who really thought about arts and health or aren't entering into this planning on doing an arts and health program. A lot of times we're working with like arts councils and artists who just suddenly find themselves in this situation where their community experienced a disaster and needs something. And so they don't even often know what arts and health is as a concept. They're not familiar with things like the national organization or our programs, but what people are really asking for and building very much is arts and health. And because for so many of them, they're in a space where they don't know kind of what that looks like. They're not familiar with practices. They're really eager to partner with people who do and very grateful to have, whether that's kind of experienced artists or arts and health professionals or creative arts therapists to partner with and doing some of that work. So I think that's most recently, especially in Western North Carolina, where we just finished up some projects related to Hurricane Helene, where I've really been reminded again of how important this is.
Thank you. I think you guys, we're going to come back to you in a minute, but if you want to turn your cameras off, we're going to do a quick overview. The reason we're able to bring you all together today is we're going to talk a tiny bit about the graduate program, and then we're going to come back for our questions in just a minute. I'm going to share my screen with you guys now. You guys can see that all right. So the University of Florida has a Center for Arts and Medicine where we have graduate programs in the field of arts and health. We have the Master of Arts in Health, it's Arts and Medicine. I'm sorry, the Master of Arts in Arts and Medicine. We have the Graduate Certificate in Arts and Medicine, and we have a combination BA to MA program, which is for University of Florida undergraduate students that are in programs with music, pre-health, public health, microbiology and cell science, biology and chemistry. Our program is asynchronous, 100% online and in your community. So while our courses are not self-paced, they usually have assignments due on a weekly basis, but you can access your assignments at any time during the week. Our assignments do have regular deadlines. We are cohort-based, and we have peer interaction. I'm sorry, I have a little screen issue, but I have tech support right here. We have, thank you. We have our faculty, so a cohort base. So with our cohort, you have peer interaction through things like discussion boards and through peer review. Often our students will start within the class having conversations, but then they often take those beyond the classroom as well and have personal communications. One of the really important things about your graduate program is the opportunity to build an important network, which I think we've heard throughout our panelist discussion today, is those relationships are important. And our faculty have office hours and they're available to meet in real time. What I would say about that I'd like you to keep in mind as well is that our faculty don't only want our students to succeed through their work on the program, they're looking at you as becoming their peer and future collaborators. So take advantage of those office hours. So we have, with the Masters of Arts in Medicine, this is a 35-hour credit hour program. You can complete it in 2 to 3 years. Tuition is $25,000 or $25,047 total. There are no out-of-state fees. This includes core courses, electives, practicum, and a final capstone project to kind of pull together what you've been doing in the program. And financial aid and scholarships are available. We also offer a graduate certificate in arts and medicine, which is 12 credit hours. You can complete this in around 10 months or 3 semesters. Again, no out-of-state fees. It includes your core courses and practicum. And again, you can look into financial aid and scholarships through this program as well. We kind of think of this as an accelerated option for earning a professional credential. We also have a combination degree for our bachelor students here at University of Florida within pre-health, music, biology, chemistry, microbiology, and cell science and psychology. So if you're thinking about doing that, you can complete your bachelor's and start an online master's. And in that process, you get up to 12 credit hours from our master's program as part of your undergraduate program. And we can talk about that. You'll find my information to each other at camadmissions@ufl.edu. And we can talk how that applies to you in your program if you're one of those students joining us today. This helps you save time and tuition by combining your credits. You would look at doing this in your sophomore or junior, senior year. So when you're looking at the Master of Arts in Medicine, you can see that our core courses are Foundations of Art and Medicine, which we call this our foundation class. This is what is arts and health. Then we have Arts and Medicine and Practice. So we call this one Practice, and this is how to become a practitioner of arts and health. And then we have our practicum, which is a really hands-on course where you're doing work in your community, followed by Arts in Medicine Professional Seminar, which is reflecting on the work that you've done in your practicum, as well as looking at professional skills. And you'll notice that if you're looking at getting the graduate certificate, those are the exact same courses. So that first batch of core courses in the master's are the graduate certificate courses. You have a second round of core courses in the MA program, which include research and evaluation, a capstone proposal, your capstone, and then an advanced professional seminar. And then master's also has 4 electives, and these vary from time to time, but it could be something like arts and compassion, arts in the military, arts and public health and community impact, or an independent study. This is kind of what your classes might look like if you were doing a arts and medicine MA. You might be doing your foundations and practice and an elective in the fall of your first semester, followed by your practicum and elective in the spring, and then arts and medicine professional seminar and research and evaluation in the summer. In your second year of the program, you would be doing something like your arts and medicine capstone proposal and your professional seminar and an elective in that fall semester, followed by arts and medicine capstone and your elective in the spring to wrap up your master's. The graduate certificate, you can kind of see it laid out here. It follows a very similar trajectory where you're doing your foundations or practice in the fall, your practicum in the spring, and a professional seminar in the summer. And if you're looking at these courses and you decide you want to do the graduate certificate and you fall in love, as our students often do, and you're like, you know what, I want to do the Master of Arts in Medicine, I want you to consider that those courses that you've already completed will apply to the master's program. So it is completely doable to look at your schedule and switch over from the graduate certificate to the master's along the way. When you're looking at our program, there is no GRE needed. You would want to apply now for fall 2026. The applications must be submitted by July 1st. To apply to the program, you would need a personal statement, letters of recommendation, your CV resume, your transcripts, a writing sample, and the portfolio. And when it comes to the portfolio, I would encourage you to reach out. We can have a conversation if you have concerns about that. We're looking at that to kind of get a scope of what your interests are and what you're up to. But also we have faculty mentors assigned to the students in our courses. So we want to make sure that we are finding the right fit for that. Something I just want you to keep in mind if you're considering a graduate program with us, while our program is online, it was designed to be in your community from the beginning, and it's been that way since long before COVID. You are still graduating with the same degree that anyone at the University of Florida graduate programs graduates with, and you are welcome to walk at graduation if you want to be a part of that as well. The University of Florida is a premier public land and sea grant R1 research university. We're consistently ranked among the top public universities in the US. The UF Center for Arts and Medicine is one of the first programs in the field, and it's a leader in arts and health today. We have access to things like the Career Connection Center and Gator Link Network when it comes to being a University of Florida student. You also have access to online libraries and research databases, and you graduate as part of the UF Alumni Network. So you really do have that Gator identity as part of our program too. And you'll find ways to connect with us in the chat, including some information about if you want to reach out to me and have a direct one-on-one conversation, we can follow up with that. And now we're going to kind of switch back to our panel questions.
I just wanted to answer one of the questions in the chat real quick about scholarships for the center, because it's easier to say it than it is to type it. The center itself offers 2 scholarships sort of irregularly, and they're both for already enrolled students. They're not huge scholarships, to be totally blunt, usually a few $100s at a time. And information about those scholarships becomes available when funding is available if you are enrolled as a student. So that being said, most forms of scholarship at the university are housed under the Student Financial Affairs website here at UF. So if you want to explore what your options are, that would be the best place to look. So I will put that link in the chat.
Okay, thank you, Brandon. So if we're looking at some of our questions, let's see. I'm going to start with a toughie first, and we're just going to hit it head on. So we would say something talking about self-employed. Okay. So if people are looking for jobs in the field, what are some keywords that are helpful for looking at, or how can we look at things? Because if we look at arts and health, that's not usually the first way that these jobs are listed. Sometimes it is, And that's fantastic. But what are things that you look for when you're looking at job postings? Or is jobs postings the way to go in the field? Does someone want to jump on from our panel?
I can, because I'm kind of, looking at a lot of this right now, and I tried to respond some in the chat. I would say, yeah, you don't want to just search, I want to be a professional arts and health practitioner, or, you really have to start to dig into, um, first of all, why you're interested in this. And for me, it's really connecting people. And I found for me, the social prescribing kind of realm within arts and health is where I want to go. But some people, again, like Ricky, really want to be clinical in nature or in a clinical space, sorry, doing more bedside sort of interventions as an artist. So I think it takes some self-reflection as to what direction you want to go. And what I love about this field is there's room for everybody. It really runs the gamut from if you want to be organizing, community organizing, or if you want to be very one-on-one working with participants. So I think it requires a little bit of reflection as to where you want to go. Um, and I know a lot of organizations like Anna was talking about Dance for PD. There are some established programs that if you really want to work with people who have a chronic illness or maybe an aging population, there's already a lot of resources in that direction. I know the Benjamin Rose Foundation, even though it's not an arts and health position, will have sort of creative programs and they'll post roles in that domain. I think keywords, and AI can be helpful for this. If you type in, this is what I'm interested in doing, can you help me come up with some searches? That can be a tool. But I think ultimately you have to think about where you want to go. And somebody else talked about, and this is the identity part again, formation, Brandon, but if it doesn't exist yet, if you keep kind of knocking in spaces where there are like-minded folks and explain what's happening, then oftentimes you realize there are arts and health related programs or positions that are there. They just aren't titled like that at this point.
Thank you. I appreciate that, Kate. I'm going to ask if one of our faculty want to jump on this question. I have a question in our list that's saying, what is the main difference between the certificate and the master's program? So beyond the depth of time, so we know that one's 12 credit hours and one's 35 credit hours. If someone's considering the program, what's the difference?
I can jump in first, Heather, and then if there's anything you'd like to add, please do. So the certificate and MA students, the first year of the program is exactly the same for both of them. You'll take a course called Creativity and Health, Foundations in Arts and Medicine, and then you'll learn about arts and health in practice, and you'll have the opportunity to do a practicum in your community where you go out and you practice as an arts and health practitioner. And then after that, the MA students take a course called Research and Evaluation in Arts and Medicine, and they develop their own capstone project where they work through the institutional review board process within the university and develop a small evaluation or research project in an area of interest. So that's the main difference between the two.
Yeah, the only other thing I think you get when you do the master's program, aside from that in-depth research and evaluation experience in the capstone, is the opportunity to take electives. So you do get a little bit more breadth and the opportunity to learn about some additional topics that you might not have the opportunity to do as part of the certificate program. But yeah, good overview, Anna.
Right. Someone asked if there are online dance programs for autistic adults that we know of. Are we connected to any programs that come to mind with that, with autistic adults and dance? That one might be a little niche for us today, but it's always good to ask for those things in large networks. And then we have a question that's, we'll be joining as a resident physician, and I'd love to be in touch with arts and health and continue the interest in the practice. They're asking about means to consider arts in medicine as a resident physician in their future practice. Do you guys have any thoughts on that? How does arts in medicine play a role in the physician path?
Yeah, I mean, I guess some of it depends on the residency and how open the site is. I think we've had physicians come through our program. There's certainly lots of ways the work can overlap. Certainly, social prescribing works a lot with physicians. But in most cases, I think those physicians are having to do that type of work outside of their residency or their work, or we're finding a really unique opportunity to do it. So if you have room within the constructs of kind of your program and they allow for it, there's lots of connections you can explore. Or if you have the ability to do some of that work outside of it, again, social prescribing is one way that comes to mind, but there's also physicians who are doing some really direct arts and health work as well. And medical humanities is something else to explore. I think there's a lot of overlap with medical humanities and arts and health. And that's something where you might find a like-minded group of physicians who are really interested in the ways that the arts can benefit people.
Well, thank you guys for meeting with us today. We're going to wrap up. Please don't hesitate to reach out for the CAM admissions at ufl.edu if you have more questions or if you want to follow up. And I thank you for attending today. We appreciate you being here. Wish you a great day.